Joe Montgomery here from educationlawyers.com with your coronavirus update. We want to keep you all updated and informed as parents and students because we know that obviously COVID-19 is having a tremendous impact on the way we're learning. A lot of folks starting cyber school for the first time today or yesterday. So today is March 16th, and we're going to try to keep you updated every single day, if not every other day, with the current events and how it's specifically affecting schools and learning. So hope everyone's staying healthy, hope everyone's staying relaxed. You know, I think it was like last night, Chris Cuomo on the news talking about, this is so easy, just stay on your couch, you have nothing to do. But obviously it's greater than that, right? I think that's minimizing what's happening right now because we're scared, right? There's fear, there's uncertainty, there's many people out of work, right? So it's not just sit on the couch and play video games and watch Netflix, it's stay home and worry, right? And not be allowed outside and be afraid that you're affecting our elderly humans, right? Our fellow humans who may be more susceptible to the severe consequences of COVID-19. So I don't think it's as simple as just, stay inside and relax, because I understand there's fear. But I do also understand that the more we know, the better we can deal with the fear, right? And I understand that uncertainty is awful, right? It's one of the most challenging feelings to have to deal with, not knowing. So to the extent that I can help you know what's going on and to give you a little insight into how COVID-19 is affecting school and education and cyber learning, it's my pleasure, right? Do I have a little bit of free time right now? Maybe. We're still handling all of our cases. We're still doing everything we have to do. Really, things haven't slowed down here. We're working remotely, but we're working. But there's definitely still some free time. So in that free time, we are combing all the news, but we're also combing letters from the government to schools and school boards, and we're speaking with parents' attorneys, and we're speaking with school attorneys, and we're trying to figure out what's really going on. So we may have a little bit more access than you do, and we're going to use our access to inform you to the best we can and keep you up to date with what's going on with COVID-19 in schools. And you can stay up to date at educationlawyers.com/COVID, COVID. Not that I need to tell you how to spell that, since it's probably the word you've seen most in the last week, other than your name maybe. But educationlawyers.com/COVID for up to the day, at least, if not up to the minute, updates. Links, resources, anything that can help you, we're going to have at educationlawyers.com/COVID, COVID. So here we go. So coping with COVID-19. Again, anything we can do to help, we're here. Now that the COVID-19 pandemic has forced the closure of all public schools in Philadelphia and across Pennsylvania and New Jersey and most other places, parents have a lot of questions about how to cope with the crisis and, more importantly, how to help their school-age kids manage the sudden halt in their routine and the stresses that come with it. And this is especially true for kids who don't do well with changes in routine. For example, children with autism who thrive on consistency and now all of a sudden have a totally different schedule, right? It took us January, February, March, however many months to get into their school routine, and now the rug's pulled out from under them and they have to learn something entirely new. So let's keep that in mind too, right? We're all struggling at home, right? But having a kid at home, having a 5-year-old at home, I do, it's tough, it's not easy. Having a kid with disabilities who doesn't do well with change, much harder. So there's levels to this, and that's why we really have to be kind and loving and be there for all of our fellow humans. All right, so here's what we know right now as far as school closings go in Pennsylvania. As of now, Governor Wolf, our governor, has ordered the closings of all public and private schools in Pennsylvania for 2 weeks, from Monday, March 16th through Friday, March 27th. But with the uncertainties hanging over the spread of COVID-19 and the infection and the outlook for containing it, parents would do well to anticipate that the shutdown will last longer, and they should plan accordingly. New Jersey, on the other hand, while they've shut down all of the public and private schools, they've decided to close indefinitely starting Wednesday, March 18th. So it depends which way you handle social situations, right? When you're running late, you know you're going to be an hour late. I'll be there in 5 minutes. I'll be there in 5 minutes. I'll be there in 5. Like, you haven't even left yet, right? That's kind of the approach Pennsylvania is taking. We'll be there in 5 minutes. We'll be there in 5 minutes. 2 weeks at a time. right? Whereas New Jersey, on the other hand, is kind of saying we're closed indefinitely. So they're being a little more honest in this situation. They're not giving a date, but sometimes we need a date, right? Like, let's reassess in a week, let's reassess in 2 weeks. But for now, what we know is that parents probably should not expect their children back in school before May, if at all, this school year. Well, how can we predict how long the shutdown might last? It's hard, right? If the recent history of federal, state, and local government actions to restrict essential community functions like schooling is any guide, predicting when or how long is a gambler's game at best. The Center for Disease Control, CDC, is now anticipating school closures that might run to 8 weeks. So that's 2 months. CDC guidance released March 13th said that in areas with substantial community spread of the coronavirus, closures need to last a minimum of 4 to 8 weeks to serve as a larger community mitigation strategy. That's much longer than many current closures, which are scheduled again for 2 or 3 weeks. But it's not a great surprise, given the collected research and experience that the CDC brings to bear on the question. Various arms of the U.S. government have been developing strategies for combating pandemic influenza for at least the last 20 years. So hopefully those strategies are working. Those strategies generally rely heavily on ways of slowing the spread of the viral transmissions or flattening the curve, as we've heard over and over, to reduce strain on the healthcare system, particularly the need for scarce resources such as beds and ventilators, because an interesting point, and what they're pointing out is, yeah, we should be scared of the coronavirus. And yeah, it's possible to die from the coronavirus, but what's more possible is that there's someone who needs to be in the hospital for maybe cancer treatment or maybe something good like they're giving birth, and all the beds are taken with coronavirus victims, right? So the more beds available, it's not only to combat the coronavirus, but it's everything else that's always coming in the hospital, right? So this is just in addition to already sometimes understaffed hospitals. So what does flattening the curve mean? Again, we've heard it over and over. Flattening the curve refers to the goal of moving from the peak of a viral outbreak, when the rate of discovering new infections is at its height, to a period of flatter growth or hopefully decline in new cases. One measure essential and universal to containment strategies is closing schools, either reactively in response to a cluster of student infections or preemptively, which we're seeing here, to help slow the transmission rates. So that's the good news. A lot of the schools here are closing not for what's going on today, not the narrative today, but 2 weeks from now, because right now we're sort of living in the future. What we're doing today is going to affect the future. So that's why it's important that even if our numbers aren't so high today, that we take the right steps today so that tomorrow, which is 2 or 4 weeks from now, is brighter. So let's look to history to get an idea of what we can expect today. Studies analyzing the 1918-1919 Spanish influenza found that cities that closed their schools earlier had lower death rates. That's good. For instance, St. Louis closed its schools proactively and experienced a 2.2% death rate. Pittsburgh, on the other hand, waited until the peak of the crisis to close its schools and experienced a death rate nearly 3 times higher. So let me talk about 2 things with that. First, calling a flu the Spanish influenza, right? Just yesterday, Trump tweeted something calling this the Chinese flu, which I don't think is a good idea, right? Of course, we don't want to attribute this to one country or nation. Maybe it started in China, maybe not. I don't know, right? I don't know the pedigree of this virus. I know that we're all in this together now, and I know that we have to look at it as COVID-19 because we need to really just look at the compounds of what make up this virus so we can fix the problem. I don't think now's the time to be placing blame on anyone. I don't think now's the time to be avoiding Chinese restaurants. I'm still eating Chinese food. Did the food just come? I actually just got a Chinese food delivery right now, and I'm gonna eat this as soon as I'm done recording. Again, I haven't stopped any. Please don't refer to this as the Wuhan flu or anything else. Let's keep it at coronavirus or COVID-19. And the other point with that is that it is good news, right? We're being proactive, not reactive. I think a lot of people out there aren't seeing the number of cases that we're seeing in other countries in America. But again, that's today. We need to look to the future. We need to continue to be proactive. And I think that's going to take us really far. However, closing schools comes with its fair share of problems, of course. One of those problems is the fact that a lot of families, and a good amount of families in Philadelphia, rely on schools to provide meals for their children, breakfast and lunch. So what's being done about that? The good news is, in Philadelphia, the school board of Philadelphia and other city agencies have efforts underway to make sure that children who normally take meals at school will still have access to those meals. Again, good news. As of this writing, 30 area schools will be providing up to 2 shelf-stable grab-and-go meals a day between the hours of 9 a.m. and noon every weekday. A current list of those meal locations can be found at educationlawyers.com/COVID. In addition, the city announced that there will be an afternoon meal available at 3 p.m. every weekday at up to 50 city recreation centers. That's as of now. So again, keep track of the locations and everything else you need to know at educationlawyers.com/COVID. Another question we may have, what's the risk to my child, right? Information about COVID-19 in children is still somewhat limited, but information made available by the CDC suggests that children with confirmed COVID-19 generally had mild symptoms. More good news. A small percentage of children have been reported to have more severe illnesses. However, they may have been children with chronic medical conditions. People who have serious chronic medical conditions are believed to be at a higher risk. We know that, right? That's what we've learned so far. Despite lower risk of serious illness among most children with COVID-19, those children still should avoid contact with others who might be at higher risk, such as older adults, maybe parents or grandparents, or those with serious medical conditions. Another problem we're facing, or at least may have considered, is mandatory school timelines in Pennsylvania, getting those 180 days in. The governor has suspended the state requirement that school districts and schools provide at least 180 days of classroom instruction in the school year. So that means that as of now, we might not be expecting the school days to be tacked on to the end of the school year, as we would see with a snow day type situation. But that's, again, even if we start school this year. Again, there's a chance that school does not resume for the 19-20 school year. But at least we know that the 180-day requirement is no longer a requirement. So students, possibly students in their senior year of high school, can still expect to graduate on time, at least hopefully. Despite there being no 180-day requirement, it does not give any school or school system a pass on its obligations to give equal treatment to students with disabilities and their non-disabled peers. Schools still must provide a free and appropriate public education to their students with special needs. Understanding how all of the relevant federal and state educational laws apply in the current environment is a complex task, to say the least, and subject to significant uncertainties, but there are a few principles that you should keep in mind. First and foremost, if a child has an IEP, his or her school must implement that IEP to the maximum extent practical. Now, what does that mean right now? I don't know. And what I've seen, however, is schools saying, look, if we do this for the general education students, we have to do this for the kids that receive special education. So to be safe, let's do nothing for no one, right? We don't want to see that. We want to see at least something being tried for all the students, right? Again, we have so much technology available to us. Let's use it to kind of take that step. Maybe we were pushed into the step, but let's take that step into telelearning and cyber education, and let's learn from this, right? Let's use this as an opportunity to make ourselves better. We've been talking, parents, attorneys, schools, school boards, schools. Everyone's been talking, right? There's been groups meeting up and chatting and trying to figure out what's going on and sharing resources. And still, I think the general consensus is there is a lot of uncertainty. And yeah, uncertainty, again, is one of the hardest human emotions to deal with, right? I think most people would rather live with the devil they know than have to deal with the uncertainty that they don't know. But here we are. It's uncertain times, and all we can do again is try to stay informed, try to talk to each other, and hope that good minds prevail and that we get ahead of this together. But again, the bottom line with that is that a school that makes arrangements for general education kids to get online instruction at home, for example, must generally make a program of similar benefits available to children with special needs. And that's just fair. If a student with a disability could benefit from online or virtual instruction or instructional telephone calls or other instructional activities, a school district should extend the opportunity to that student wherever possible. Schools transitioning to a remote instruction platform may be required to, or at least are well advised to, provide appropriate technology and access to all students, especially including their students with special needs, ensuring that students have required assistive technology devices provided by the school, and schools should also provide support services at home if they're relevant to the child's interim program of instruction, and if they're practical, to provide at home. During this time, parents should pay careful attention to which services the child's school does and does not deliver during this emergency period, and parents should also raise questions with teachers and administrators where there appears to be a gap in services that isn't necessitated by the crisis. Kids in cyber schools, right? There's plenty of cyber schools and cyber charter schools. I don't know what's going on. I'd love to hear from you. Maybe it's just business as usual, right? It was a cyber school to start with. It's a cyber school today. So definitely would be interested to hear from you or in the comments as far as if there has been any noticeable change to students that were already in cyber programs. There's also children who've qualified for homebound instruction, right? Before this emergency started. When a child with a disability is classified as needing homebound instruction because of a medical problem as ordered by a physician and is home for an extended period of time, generally more than 10 consecutive school days, an IEP meeting is necessary to change the child's placement and the IEP if warranted. The school district must provide at least 10 days written notice of any such change. What's left? How about talking to our children about COVID-19, right? Everyone understands something's going on. The Pennsylvania Department of Health has published useful guidance about how to talk to your children about the coronavirus pandemic sensibly and without alarm. Again, links to that guidance can be found at educationlawyers.com/COVID, COVID. Parents should reinforce good prevention habits with their children, avoiding close contact with people who are sick. Cover your mouth when you sneeze. Use a tissue. Throw the tissue in the trash. Wash your hands often with soap and water for at least 20 seconds, making sure you get the palm. It's important, make sure you get the palm before eating, after blowing your nose, after coughing or sneezing or touching a surface. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol if you have access to that liquid gold right now. What about some activities during the hiatus from school, right? We want to make sure that our brains don't rust, right? They say if it ain't running, it's rusting. So we need to make sure that we stay alert, we stay smart, we stay strong. So what are some activities children can partake in during this time home? Again, educationlawyers.com/COVID. We have some great links to use to some educational resources that will help you kind of make sure you don't become bored, right? We don't want to say like cure the boredom, because you shouldn't be bored, because we should still be learning and reading and maybe watching a little bit of that, the occasional Netflix show. But when you're all done with Netflix and there's nothing left to do and it's time to learn again, and hopefully again, at least at a minimum, your schools are sending home packets. But again, for more useful advice and tips on what to do and how to program for your children, educationlawyers.com/COVID. During the hiatus from school, the CDC recommends that children and teens be discouraged from gathering in other public places while schools are closed. Trust me, I get it. I have a 5-year-old at home. It gets tough. Not that I would send her on the streets to stay busy, but I get how it's overwhelming to have a child in the house and they're full of energy and they want constant attention, and that's great, right? I love that spirit. I love that energy, but it does get difficult for sure. So if you have teenage kids, be careful before you just let them hit the streets, because again, there's a purpose to all this madness, right? And the purpose is to, again, flatten the curve, as we spoke about. So do what we've been advised to do. Stay home to the maximum extent possible. Practice safe hygiene. And again, check back to educationlawyers.com/COVID for up to the day, I'll say maybe not up to the minute, but up to the day updates on what's going on with this virus, how it's affecting your students, and what we can expect with schools, what schools' responsibilities are, and what parents should and could be doing while they're home with their children. What am I doing? This morning I had a great virtual workout. You don't need much. Little dumbbell, right? What's the good news? The good news is we can read. There's books I've been catching up on. I'm still getting dressed to work, but it's definitely business casual, so business up front, but you got the sweatpants on because why not, right? So again, we're all in this together. Wash your hands, stay safe. Check back on educationlawyers.com/COVID for more.